Hi, my name's Matt Hirschtritt. I'm a fourth-year medical student at the Cleveland Clinic Lerner College of Medicine, doing a one-year research fellowship at UCSF through its Clinical and Translational Research Fellowship program. I chose the project that I'm going to talk about today because of my experience working in a research setting with obsessive-compulsive disorder and also my interest in psychiatric genetics. The title of my project is Characterizing Tourette Syndrome Phenotype, Symptom Factors, Heritability, and Tic Persistence. Tourette syndrome, which is characterized by persistent motor and vocal tics, is a relatively common condition, affecting between 1 in 300 to 1 in 500 children worldwide. However, even with this high prevalence, there's limited understanding of its phenotypic subtypes, its heritability, or patterns of tic persistence over time. In fact, previous attempts to subtype Tourette syndrome have been limited by small sample sizes and different analytic methods. Therefore, the aims of this study are threefold. First, to identify Tourette syndrome subtypes based on patterns of tic and other symptoms and co-occurring disorders. Second, to measure the heritability of these symptom factors. And third, to quantify patterns of tic persistence and remission. To achieve these aims, we've used detailed clinical data from the ongoing Tourette Syndrome Association International Consortium on Genetics, which consists of about 3,600 individuals ages 3 to 89 years from two separate cohorts. Tic, obsessive-compulsive, and ADHD symptoms and comorbid psychiatric diagnoses were obtained from structured interviews. For the first aim, we used a data reduction technique called factor analysis to sort individual items into mutually exclusive groups based on endorsement patterns. For the second aim, we used an established algorithm for heritability analyses to estimate the heritability for each symptom factor. And last, for the third aim, we measured the percent of subjects with Tourette syndrome who were still experiencing tics and distress from tics in each age group. For the factor analysis, described here, we arrived at a 6-factor solution for the tic and obsessive-compulsive symptoms, a 2-factor solution for the ADHD symptoms, and a 4-factor solution for all 121 symptoms combined. Interestingly, for this 4-factor all-symptom solution, tics, obsessive-compulsive, and ADHD symptoms segregated into separate factors, except for a single factor that included tics and obsessive-compulsive items that involved aggression and taboo behaviors. We present here the heritability estimates for all of these 4 factors, which are modest, ranging from 0.3 to about 0.5. However, all these estimates are highly significant. In addition, as described in this lower table, we found high heritability estimates for the primary diagnoses themselves. Last, as described in these graphs here, we found that tic remission increased in the 5th decade of life from about 10% to about 25%. In addition, levels of distress from tics tended to decrease over time, with the greatest decrease seen during the 4th decade of life. In conclusion, results of the factor analysis will be used to predict clinical variables such as tic symptom duration and medication use. These scores will also be used as quantitative variables in genome-wide association studies to investigate Tourette syndrome susceptibility genes. In conclusion, results of the factor analysis will be used to predict clinical variables such as tic symptom duration and medication use. These scores will also be used as quantitative variables in genome-wide association studies to investigate Tourette syndrome susceptibility genes. I wanted to take this opportunity to thank my mentors, Drs. Carol Matthews and Jeremiah Sharp, as well as the Doris Duke Charitable Foundation and the UCSF Clinical and Translational Research Fellowship Program. I appreciated the opportunity to have a dedicated year to do clinical research.